Hello, class. This is your quiz to review covering chapters 6, 7, and 11. Here we have the limbic system. The limbic system is the subcortex, or the areas that are in different colors of the brain. Okay, the subcortex contains the following structures: the cingulate gyrus, portions of the hypothalamus, the amygdala, and parts of the hippocampus, all of which are involved in sexual behavior. The area in dark purple is known as the cerebral cortex. The cerebral cortex is known for higher mental functioning, which also would include things like fantasies, sexual arousal and response. So the whole brain is involved in a sexual experience, but it's important for you to note that the limbic system is the subcortex, or the inner part of the brain. Okay. Areas of the body that are particularly responsive to sexual stimulation, that is erogenous zones. There are both primary and secondary erogenous zones. Primary are packed with nerve endings, making them particularly responsive or sensitive to touch, whereas secondary areas of the body have become erotically sensitive through learning and experience with one's partners, or even in a primary experience. There are two physiological responses to sexual stimulation: the pooling of blood in particular body parts, known as vasocongestion, and increased muscle tension throughout the body, called myotonia. Myotonia describes voluntary and involuntary movements, such as facial grimaces that you see here in the picture, spasmodic contractions of the hands and feet, and muscle spasms that accompany orgasm. Drinking too much alcohol can lower one's blank, leaving them vulnerable to risky behaviors. That's inhibitions. The primary source of blank in men is the testes, while the ovaries are the primary source in women. Those are androgens. Okay. Moving on to the sexual response cycle. You see here in the illustration, there is one side representing men and the other that represents female or women. In both, you see that there are four phases. There's excitement, plateau, orgasm, and resolution. For men, there is a fifth phase called the refractory period, which just describes a period in which a man's body must rest between orgasms. On the female side, you see three different orgasmic scenarios, if you will. The first is very similar to that of a man, which is represented by A. So um, for a woman, in this first scenario, this is where she actually can experience multiple orgasms, where she goes from excitement to plateau to orgasm, and her body can remain in the orgasmic phase longer and without returning to the orgasmic platform, which is how a woman can have multiples. In the second scenario, marked by B, it describes when a woman goes directly into plateau, a quick rise into plateau, um, and then orgasm without an orgasm. Okay. And in the third scenario, marked by C, it describes when a woman's body goes immediately to orgasm, very, very quick, without actually starting or stopping at plateau. Okay. Um, in any case, um, There's also one other theorist, sexologist that is mentioned in your book, and that is Helen Singer Kaplan. Helen Singer Kaplan has a three-stage model, and it is for individuals who are suffering from sexual dysfunction. With Helen Singer Kaplan, her three-stage model is desire, arousal, and orgasm. Okay. And it is influenced by emotion and physiological changes that occurs in one's body rather than the interactions between um, two people involved, as illustrated in the here. Okay. So I'm going to move on to the next prompt. Glands and ducts located in the anterior wall of the vagina can produce an ejaculate similar to that of males when stimulated in women. That area that is circled where you see the finger is the G spot. Okay. Dr. Beverly Whipple reinvigorated the research in this and the discussion around the G spot. Originally, Ernst uh, Grafenberg was the first person to discover it, but their research stopped at a certain point. And many years later, Dr. Beverly Whipple um, picked up where Dr. Grafenberg stopped and did a lot more research to develop this theory. But when naming it, she considered the name of Whipple Tickle, but instead she decided to pay homage to the first person who discovered this area, which gave her a reason to do more research. All right, moving on. When women have the capacity to enjoy blank blank, meaning they have two or more in one sexual interlude, that is called multiple orgasms. Incidentally, men do have the capacity to have multiple orgasms by manipulating the body to make that happen. There may be dry orgasms that happen before an actual um, orgasm with an ejaculate, but women's bodies are designed for multiple orgasms, where a man's body is not designed for that, but he can achieve them nonetheless. The release of blank, also known as the cuddle chemical, is most powerfully triggered by touch. Its levels tend to be reduced in autistic children, and we are talking about oxytocin. Okay, Robert Sternberg's triangular theory of love. Robert Sternberg's theory involves three elements: passion, intimacy, and commitment. When those are working together neatly, it adds up to what is known as consummate love, where there is intimacy, passion, and commitment. Okay. However, Robert Sternberg has also created different types of love. Um, these different types of love describe um, scenarios in which one or more elements is missing, such as with fatuous love, there is passion and commitment, but no intimacy, no um, closeness, okay? Or liking, where there's intimacy only, but no compassion or commitment. All right. So I want you all to familiarize yourself with these different types of love described by Robert Sternberg. Okay, according to blank, 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 the most compatible couples find that their life goals are aligned. We are talking about John Allen Lee. John Allen Lee talks about six different types of love, which are eros, ludus, mania, storge, agape, and pragma. All right, friends with benefits. Friends with benefits, by definition, is hookups that occur with no expectation of a relationship. And it was demonstrated beautifully and comedically with Justin Timberlake and Mila Kunis in the 2011 film Friends with Benefits, which involved friends who added sex to their friendship, and it created a hilarious, um, complicated situation. If you haven't seen it, I recommend that you do. Sigmund Blank view of masturbation was that if it continued into one's adulthood, it could inhibit their ability to form good sexual relationships. He, of course, is Sigmund Freud. Okay. Developing a crush on a classmate, coworker, or neighbor may be due to proximity, also known as mere exposure effect. In romantic relationships, violence is precipitated by blank. That is jealousy. Okay. Kissing. Did you know that kissing can be more intimate than sex? There are closed mouth kisses as well as open mouth kisses. Open mouth kisses are things like deep kissing or French kissing, and it's usually more intense and generates sexual feelings as opposed to a closed mouth kiss. The Kama Sutra, as you may have learned from the Kiss IQ quiz, has 17 kisses. Couples in long-term relationships tend to have similar blank styles. That is attachment. Each partner in the relationship cares for the other and knows that the care is reciprocal, is called mutual empathy. The act of reassuring and encouraging one's partner to share their thoughts and feelings openly is simply giving permission. Women could practice blank to retain their political freedom, avoid the limitations imposed by marriage and motherhood, or pursue education. They could enter a religious community such as a monastery. We're talking about celibacy. So many English women chose celibacy as a way to be free. Otherwise, they would have been subject to their husband's will if they had married. Okay. The image on the left shows a damaged or enlarged vein in the testes or the vas deferens called a varicocele. A varicocele is a significant cause of infertility in men. A medical procedure in which semen is placed in a woman's vagina, cervix, or uterus to facilitate conception is artificial insemination. A hormone that is detectable in the urine of a pregnant woman within 1 month of conception, that hormone is human chorionic gonadotropins, or HCG. There's also a very sensitive blood test for HCG that can detect pregnancy as early as 1 week after conception. So the urine, 1 month, or the blood test, 1 week. The U.S. Supreme Court's landmark decision on January 22nd, 1973, legalized a woman's right to terminate her pregnancy before the fetus can survive independent of the woman's body. The U.S. Supreme Court overturned blank blank on June 24th, 2022, in the case of Dobbs v. Jackson, Women's Health Organization. So we are definitely talking about Roe versus Wade. And it's amazing that it was in existence for nearly 50 years before it was overturned. Syndrome in infants caused by heavy maternal prenatal alcohol use, characterized by congenital heart defects, damage to the brain and nervous system, numerous physical malformations of the fetus, such as a small head, flat mid-face, underdeveloped jaw, thin upper lip, short nose, small eye openings. We are talking about fetal alcohol syndrome. Oh, and also a below normal IQ are all effects that come from prolonged alcohol use that continues through a woman's pregnancy. Okay, here we are looking at the three stages of labor. So, in the first stage of labor, you have effacement and dilation, and it relates to the first two in this illustration. That tends to take the longest. It could be uh, actually it's really hard to determine how long that would be. The information that I got it from says 4 to 8 hours, but it could happen very quickly, or it could take 3, 4, 5 times longer than that. Um, Here in 3, that looks like the stage of crowning. In 4, it looks like the stage where there is the ring of fire. All right, so this all here is the first stage, which has many steps to it. Down here at 5 describes the second stage of labor, which is birth. Okay, so you have the complete extension here, you have the restitution here, you have the anterior shoulder coming out here, and you have the posterior shoulder coming out here. Once the head and the shoulders are out, the baby just comes out. Usually that takes anywhere from minutes to maybe an hour for birth to happen. What is not in the illustration is the third stage, which is the delivery of the placenta. And usually the delivery of the placenta happens within about 30 minutes after birth. Okay. All right. Symptoms of depression postnatally describe this last term here. In extreme cases, the mom loses interest in her baby or may develop obsessive thoughts about harming themselves or their baby. And we're talking about postpartum depression. There are 5 types of postnatal or postpartum depression. There is postpartum blues, also known as the baby blues. They're mild and usually subside in less than a year. It's typical that it lasts maybe about 6 months. In comparison, postpartum depression is moderately severe and can last for more than a year. However, postpartum anxiety, postpartum obsessive compulsive disorder, and postpartum psychosis are more severe forms of postpartum depression and should not only be diagnosed by a doctor, but also the mom should be in treatment for that. All right. The extra credit question comes from the Business of Being Born Drug Interventions. That is in your module. Um, just read through the list, familiarize yourself with the terms and the side effects, and you should be fine for that. All right. That is all for your quiz review. I wish you all luck, and I will be talking to you very soon.